Hello, today I'm going to discuss how to handle residual astigmatism following cataract surgery. There are various approaches we can consider. We did an intraocular lens exchange. The patient was a 69-year-old woman. She had previously undergone cataract surgery with an Eyhance lens. When? Just a month ago. She had cataract surgery at another clinic. Now, she complains of blurred vision. She also feels dizzy when looking far away. At the previous clinic, they targeted her right eye for distance vision and her left eye for intermediate vision. They opted for monovision. In these situations, while the Eyhance lens provides a wider focal range, it does not quite reach the effectiveness of a multifocal lens. Therefore, when you adjust the Eyhance lens to achieve clear vision at a distance, it results in a compromise, sacrificing clarity for near vision. This approach was chosen to balance these differing visual needs effectively. So, when we did a refraction test, there wasn't a significant difference. This is called mini monovision. The right eye measures at -0.0 diopters and the left eye at -0.75 diopters. However, while the right eye had no astigmatism, the left eye exhibited 1 diopter, indicating more astigmatism in the left eye. So, because there is both myopia and astigmatism, the left eye has more overlapping vision and reduced visual acuity. To address this problem effectively, if the cataract surgery was performed recently and the procedure was executed correctly, choosing to replace the lens might offer the fastest route to recovery. Therefore, let's proceed by dilating the left eye to continue with the treatment. When considering the possibility of resurgery, it is essential to thoroughly assess the condition of the initial procedure, especially focusing on whether the anterior capsulotomy was performed well and if the corneal endothelial cell count remains healthy. If these conditions are satisfactory, resurgery can be approached with less concern as we manage to correct the issue using the same intraocular lens platform. We adjusted the astigmatism in the lens. However, there is opacification of the posterior capsule. The wrinkles and cloudiness present in this area can also play a role in diminishing visual acuity. It's important to keep in mind that removing the posterior capsule can complicate future lens replacement, so this procedure should only be considered when a future lens exchange is unlikely. We replaced the lens with an Eyhance lens. This corrected the astigmatism. After stabilization, we used the WAG laser treatment. Now, let's look at the results. Initially, the visual acuity was 0. After surgery, it improved to 0.6. This change was noticed right after the procedure. Visual acuity is now above 0.8. With correction, it's 1.0. Another method for vision correction involves corneal ablation, which can be performed using techniques like LASIK, LASEK, or SMILE. However, it's important to understand that these procedures reshape the cornea and may not be as straightforward as lens replacement. This procedure isn't suitable for every surgeon. When done precisely, patients can have excellent vision the next day. Recovery is very quick, making it a highly effective choice. Yes, everything went smoothly. Trust us with your visit. We will do our best to ensure a great outcome. Thank you.